All right, wonderful. Well, happy Tuesday. Happy Valentine's Day, everyone. Thank you for spending a little bit of your Valentine's Day with me. So today I decided that I really want to focus on heart health. Obviously, Valentine's Day, the heart, if I can get that correct there. Your heart right here is super important. We only have one of those things and they matter a lot. And so I'm going to share some information with you guys tonight about some patches that directly impact the heart in a positive and beneficial way. Before I do, I just want to give you guys just a little intro on the science and technology. For those of you that are guests, I want you to know who I am. My name is Dr. Staci Holweger. I have a PhD in integrative medicine and a PhD in functional medicine. I have been in holistic health for 20 years. I am not a medical doctor. I am not your medical doctor, of course. And so if you have any questions regarding your health, of course, any concerns, please check with your physician or your healthcare practitioner. The information that I'm going to share with you guys tonight is information for informational purposes only. I'm not intending to obviously diagnose you or claim to treat or cure anything, but I will share with you that the information that I'm sharing tonight is based on clinical studies. I'm going to do a little screen sharing here in a little bit and show you guys some of those studies and where you can find some of those for you to read as well. Believe it or not, they're not that hard to understand what's being said in them. Many double-blind placebo from independent labs and doctors all over the world. And so I'm going to share with you a little bit of information, like I said, on what this technology is and how it works and where it came from. And so the inventor of this technology, his name is David Schmidt, and David Schmidt is a scientist. He's an inventor. He's a researcher, and he's the inventor of LifeWave, what we are talking about tonight. It is a non-transdermal patch that David has invented, and this patch does not put anything in your body. Neither do any of the patches that David has invented. Non-transdermal means nothing's transferring in. I'm sure you're familiar with transdermal patches like nicotine patch or pain patch or birth control patch. Those are transferring a substance or a chemical into the body. So this works differently. This works with your body's heat or light that you emit. And so no chemical, no substance, no nutrient, nothing is on the inside of this patch. And so when I say that your heat or light that you emit, if you feel your chest, you're 98.6. If we were to go outside right now, I live in the East Coast, and so it's dark outside. It's you can't see anybody out there. It's too dark. But if I had night vision goggles, then I would be able to look through those and see the outline of the people or animals that were outside. I live out in the country, so there's lots of wild creatures out there. And so we know that we're emitting that heat because we can see that through the goggles. And so when you put this patch on that David invented, this patch works with your body's heat or light and reflects back a very specific wavelength of light back into your body. That wavelength signals peptides. And like I said, David's invented many patches. Actually, he's invented a dozen patches over the last 20 years. And the patch I'm going to specifically talk about first is the X39, the stem cell activation patch. And that took him 10 years in the lab to figure out how to signal your body to activate its own stem cells. And so this patch, as well as all of the patches, and then we're going to cover a few of them tonight in detail because we're talking about your heart health, they all work by signaling different peptides. And so if you look at the inside of this patch, that white part, embedded in that is what I call a crystal lattice structure. And what that means is David, the part he's invented, is a proprietary blend of organic amino acids, sugars, oxygen, water. Those molecules form together in a very specific way to form this lattice structure that's in here. And so it's nothing that's going in your body. There's no amino acids or sugar going in your body. Remember, I said they're molecules. They're specific molecules called stereoisomers. And when they come together to form this lattice, our body's light reflects back a signal or a specific wavelength of light. So I want you to think about this. How many of you guys have heard of infrared saunas? Anybody ever been in a sauna? Anybody ever seen any red light therapy, red light beds, maybe red light, blue laser light at your acupuncturist, or those pads that they put on you that have different wavelengths, frequencies of light? And so, for example, if I go into my sauna, which I do sit in my sauna at least 4 or 5 days a week in the morning, I push a button on the little tablet on the wall that says anti-aging, and a specific wavelength of light comes into my body and helps to reverse my age. I push a different button and it says detox. And so a different wavelength of light comes in and helps to detox my cells. I push a different button, it's for pain relief. I push a different button and it's for cardio health. And so each button signals the panels on the side of this sauna to produce specific wavelengths of light that go into my body. I don't see them. You don't feel them. It's just hot, right? Different temperatures depending on what you're picking. And so this patch works kind of like that, but there's no outside light source. You are the heat source or the light source that this patch is working with. So I hope that makes sense to you guys to understand. You don't need to be in the sun. You don't need to be in the light. This can be underneath your skin. It's still working because we are light. We are the ones emitting the heat that is interacting and communicating with this patch. So you know what that means for you? Well, number one, it means you don't need to spend $10,000 on a sauna. Number two, it means you don't need to go anywhere to sit in a sauna. It means that it's non-invasive. There's nothing going into your body. So that means there's no contraindications to anything you're currently doing or using. It has nothing to do with any supplement, any therapy, or anything, because there's nothing going into the body. So there's no worries with what you're already doing. So know that it's safe, it's effective, it's easy. There are no side effects, which is amazing, other than, well, there's lots of benefits that you feel. And we'll talk about some of those tonight. But know that it's something that you can use no matter what you're doing. You put this on in the morning, actually, when you get up. CV7, cervical vertebrae 7, is back there behind your lower neck, or you can put it below your belly button, or honestly, any spot works. And the reason why we have in the instruction booklet CV7 or below your belly button is because, like I said, we have clinical studies. David has spent 20 years doing clinical studies, some of which I'm going to be pulling up here in just a little bit. And so you know that this has been backed by real people, testing this product on real people all over the country, and all showing to see benefits and improvements in the systems and the organs and the tissues and cells in the body. And we have many metrics that David has used and other doctors and practitioners have used to be able to test the effectiveness of these patches. So know that it's safe, that it's effective. It's proven. We have a website we would love you to go to. It's startx39now.com. And I'll put that in the chat for you guys. So it's startx39now.com. And that chart, that chat, not chat, it's in the wrong place. That website, if you go to that website, you scroll down a little bit and it says studies and patents. We actually have a 20-year patent on this specific patch, the X39 stem cell activation patch. All of our patches are patented, which means that no one else can get their hands on that, right? So you're only going to get this from the person that invited you here tonight. And if you're a brand new brand partner with us, welcome. We're excited for you to check out startx39now.com. Check out the clinical studies. Make sure you look over that information, because it's a fantastic resource, and it shows that we're doing things to help people improve their quality of life in a really, 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 really big way, and making a big impact. And that's why we're here, right? To help people improve their life and feel better. And then also to prevent, you guys, you know, when I found out about this technology, I've wanted stem cells for a long time. My daughter, I did over 10 years of different types of stem cell therapy with her in and out of the country. I've banked both of my kids' cord blood. I found out about stem cells over 20 years ago, but I didn't like that expensive price tag. And, you know, there's always risks. It depends on where you're getting your cells from. It depends on, you know, if hopefully they're a clean, healthy source, right? Maybe a donor umbilical cord, but that can be super controversial. And, you know, the price tag, like I said, very, very expensive. You know, we were spending over $25,000 for just a stem cell injection. And so they can be very costly. Sometimes they're, maybe $5,000, $10,000. It just depends. And there's side effects, right? Their cells could divide incorrectly. And so knowing with this, that there's no side effects, there's no risk, there's no chances that your cells are going to divide incorrectly. They're yours, right? And it's the price of a cup of coffee a day. I was like, sign me up. I'm all about prevention. I'm all about vitality, about longevity and wellness. And so that's why I'm here. That's why I'm sharing with you all. So let's talk a little bit about heart health. Okay. I'm going to talk about these 4 patches and then I'll get to answering your questions. So of course, we're going to talk about X39, the stem cell activation patch. And X39 is the patch, like I said, that has a 20-year patent. It's just been out for 4 years. It took David 10 years in the lab to figure out how to do this. And how this happens is when you put the patch on, it immediately goes to work to reset a third of your genes back to their young, youthful, healthy state. How that happens is because this patch signals a peptide, which is called GHKCU, copper peptide. You can Google it. You can go to a website, reverseagingwithghk.com. You can see Dr. Lauren Picard, who has nothing to do with LifeWave. He spent 50 years researching the benefits of GHKCU. It declines as we age. So David figured out how to signal GHKCU. GHKCU, and exactly what I said, resets a third of your genes back to their young, youthful, healthy state. We know genes express to other genes, so I'm going to talk about a compound effect of using this patch here in a little bit. But one of those genes that this patch signals, that this GHK copper peptide signals, is called P63, and P63 mobilizes stem cells. Now, you guys were born with an abundance of stem cells. We all were. That's why we were young. We were youthful. We had boundless amounts of energy. We could sleep at the drop of a hat. Go, 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 ride our bike, fall over, break a bone, and pick up and take off running again, because our stem cells were always working to repair and regenerate. Well, as you age, you have less and less stem cells that are active in your body. They're there, they're old, they're wore out, they're tired, they're dormant, they're just like, not interested, don't have the energy anymore. By the time in your 30s, you have half of your stem cells active. And by the time in your 60s, there's really less than 10%. And we know this, of course, by looking at the blood. We can tell that there's less than 10% by the time you're 60s. After that, there's none detectable. So this wakes up your stem cells. It says, hey, come on, you're there. Let's go. Let's get moving again. Let's mobilize you. Let's activate, elevate you, but let's also reset you back to your young, youthful, healthy state. And we know for a fact when we take old tissues and old cells, we put them in a petri dish, we can take young, youthful, new health cells and put them in a petri dish and poof, they make those old cells not young and new again. That's just what happens when you do that. So think about inside of your body, when your cells, your own stem cells, are reset again back to their young, youthful, healthy state, then we can see the effectiveness of them making your cells, your tissues, your organs young and youthful and healthy again. What does that mean for you? Well, it means a better quality of life, right? It means that we're going to start to cross some of those things off your list, those problems, those aches, those pains, maybe the restless legs, the sleeping issues. You're not getting a deep sleep. We're going to be able to help you with more mental clarity, more energy, more concentration, more focus. We're going to help you with faster wound healing, right? Johnny's riding his bike and breaks a bone, keeps on going. You're going to have the same ability to be able to heal faster, to repair your body faster, because your stem cells are active again. They're mobile and they're working to repair and regenerate. And so we see a lot of things happening physically and in the body, as well as emotionally and mentally too. But one of the things with this specifically is your heart. Now, we can't pick where your stem cells go. I'm going to be completely honest with you, which is why I'm going to talk to you about some of these other patches. Your stem cells, you don't get to say, this is a stem cell injection in my shoulder. Go to my heart and fix my heart immediately. Go to my shoulder and fix my shoulder immediately. Go to my knee and fix my knee. Can't do that. Your body knows how to repair itself, right? It has its own innate ability to know how to do that. And so you're going to have to be okay with it fixing itself in whatever order it wants. And so that's what I was talking about earlier with the compound effect. Genes express to one or two other genes. And so when you reset over 4,000 genes, the longer you use this technology, then the more benefits you will gain. All right. So we use this day after day, week after week, month after month, even year after year. I interviewed Dr. Sanders last Thursday, who is a pharmacologist who had a heart attack. I don't know if you guys saw that interview or not. It's fantastic. You can look it up on Telegram. But he's been using the patch now well over 2.5 years. And it's miraculous in what's happened with him. But in a nutshell, really quickly, he had a heart attack at age 45 and or 47, he's 65, 66, something like that now. But at the age of his heart attack, his heart was functioning as a 75-year-old. And, he's been on all kind of prescription medications, statins, all that kind of stuff. And, years go by, no improvement in his heart, still functioning as a 75-year-old, still in his 40s, 50s, 60s. He started doing supplements, nutritional things, no changes, heart still functioning as he was a 75-year-old. He started using this patch. 1 year in, his heart is now functioning as someone in his mid-30s. Nothing changed. Nothing was different but this patch. So he's just one example. You can also look up Dr. Harmon, who had a right branch bundle block in his heart, which dramatically reduces your lifespan. And he had PVCs his entire life. Within about 7 months, 6-7 months, gone, just gone. No idea why, how. Cardiologist is like, you just don't get rid of a branch bundle block. It doesn't happen. You can look up his testimonial as well, too, on the Telegram. But this directly will impact your heart. We know that. And I'm going to share with you guys a study. I'm just going to pull it up here so you can see it real quickly. I have quite a few here. So let me see if I can find which one it is. So if you go to startx39now.com, the site that I put in the link, you can see this is there's a couple of videos on here, right? You can click and watch the videos, but see where it says patents and studies. So if you click that, it's going to show you the patents and studies, and you can click through all these different things. Okay. All of them, but here you can start seeing the X39, X49, things like that. I recommend you click on them. They have a lot of great information, but let me see if I can find the one that I'm looking for that has, let me see where I find it here. It shows you here, this one. So vascular age. So this is a study that was done. Your vascular system, your heart is obviously part of your vascular system, right? And so this is showing the improvement in the vascular system. So here's your baseline, right? And in this, what it's showing, this is with the X39 only. What it's showing is this is the age of your vascular system. Okay, which is your circulatory system, your cardiovascular system, all of that. So it's showing about, I feel a little over 58 years old. Okay, you can see at 3 weeks, it's still the same. Nothing has changed because people are like, when am I going to see results? We're like somewhere between 3 to 6 weeks for most people, but some people it's 3 to 6 months. Well, this study shows that not at 1 week, 2 weeks, 3 weeks, 4 weeks, or 5 weeks, but at 6 weeks, we could see a dramatic reduction, which doesn't look like a lot. If you look at, it looks like maybe it's not quite a year, but when you're looking at the vascular age, this is a significant, what we call significant improvement in the vascular system, that at 6 weeks, it's now functioning younger than it was at the baseline. Okay, so obviously that's not a full entire year younger, but it's still significant. And when you're looking at what did you do different, you put this patch on in the morning, you stayed hydrated, and you went about your day. And in an 8 or 6 week period of time, your heart and your vascular system are functioning about 8 weeks younger than they were before. Or if you look at this year-wise, quite a bit, right? And so big difference in this time frame here in just a 6 week period. So what does that mean for that compound effect? It's pretty significant in what it means, really, when you think about it, like I said, with Dr. Sanders and with Dr. Harmon, and there's many others as well, too. So you can go down through these studies and peruse through them at your leisure, what you like. But I want to share with you, there's one other that I have on here. Let me get this off here. Let me find which one on the, that one's on heart rate variability with Eon. We'll do that one in a second. Here on blood pressure. Okay, so this one is talking about, if you look at table 7. So table 7, this is talking about the measuring of normalization in blood pressure. And so if you look through this study, I don't have time to go through all of these, of course, but I wanted you to see this to show that there's a significant difference in the blood pressure, improvement in the blood pressure from the control group, which means someone that's, using it versus someone that's the active not using it, right? Control not using it, active is using it. And so we can see a difference. This is measuring a lot of different things in this study. but specifically looking at the blood pressure and what's happening. And so this is a study. I'll show you the beginning of it so you can see it, right? The changes in the X39 patch. Again, huge improvements in the heart with this one, with blood pressure, which is obviously the heart. And then I believe I have one more here. Let me see what this one is. No, I think that was it. Okay, let me close out of that one because I don't want to repeat those. That was with Eon. Yeah, that was Eon. Heart rate variability. Same thing. I think this is the, let's see which one this one is. Sounds like a lot, right? Double blind, placebo, pilot study, looking at, so when you look at the studies, you can see the introduction kind of goes through all the basic stuff, right? But you want to look at what happens with this is all about heart rate variability again. So heart rate variability means your heart's ability to balance itself, to stay in sync where it should be. People talk about their heart racing, jumping, feeling like their heart's racing out of their chest and things like that. And so we can see the improvements pre and post of using the right here, the 4 different types of ways to monitor, measure the heart. So you can see frequencies. So we're significant changes for the experimental group, but the control group had no difference. So control group didn't use it. The ones that did use it, the experimental group, were significant. So I just wanted to kind of show you guys these. I'm not going to go into all of that. Dr. Harmon and I are actually going to be doing a Zoom next Saturday, and we're going to go in depth with about 5 different clinical studies. He's actually taken the data. We went through the studies, extracted our key points, and he's turning them into a PowerPoint. And so he and I are going to be doing that, right? So if you have a testimonial, which I'm going to be interviewing Lori on Thursday night, of course, I interviewed Aaron Winders the other weekend with an ejection fraction, gosh, of like 12%. It's up over his 40% now. So if you have a short story to share, please feel free to share that in the comment section if you've had success in your cardiovascular system. But I kind of want to show those to you guys so you can see where to look. You can kind of see, it's gonna, if you read the conclusion especially, it'll tell you, the gist of everything. So you can say, okay, yeah, I see this is really, really happening to people and it's making a difference. Some people like the studies. And like I said, I'm sending you to the testimonial channel. Our Telegram channel be activating, because that's where you're going to hear real people sharing their personal experiences that you may know, or that you can at least, hear somebody that you know. So there's X39. The next patch I want to talk to you guys about is X49. And X49 sounds a lot like X39, right? X49 signals a daughter peptide. So remember I said this signals GHK-Cu, this signals AHK-Cu, daughter peptide. So they work really well synergistically. David invented this patch, came out with this patch a little over a year ago after clinical studies, because he wanted to do something to help people that were aging, to specifically build lean muscle mass and help them eliminate a little excess body fat. We know as we age, our metabolism slows down, pounds start to pack on, and we know our muscle mass tends to decline as we age. This is part of it. Well, what he found from the study was not only did this combo help with body fat reduction, not only did it help with the brain as well, and in building lean muscle mass and reducing body fat 11% in a 60-day period, but he found significant improvements in 2 things I want to share with you. One is the bones, stopping bone loss and increasing bone density, but also with the heart. We can see from the clinical studies with 39 and 49 being able to reduce systolic and diastolic blood pressure. That's your top and your bottom number both. So this combo here was a significant improvement in a 60-day period in reducing the blood pressure and also reducing pulse rate. And when I say pulse rate, I mean when you're sitting here, your resting heart rate, it should be a calm, relaxed, normal for your age, right? It's going to be different for all of us. Pulse rate. And these 2 here were able to lower that pulse rate. They also were able to improve the cardiovascular system in such that people were able to have more endurance and stamina and energy in their exercise, whether it was a bike ride or whether it was a walk or swim, whatever the exercise was. They had more stamina, they had more endurance, and they had a quicker recovery time as well too, which is super important for your heart. I know when I used to work out at Orange Theory, a couple years ago, and I worked out there for like 6 years, and I would, run, and then we'd have to stop and start walk for a little bit. My heart rate would go right back down to normal. Well, other people, their heart rate would stay, because you could see everybody's heart rate on the screen in front of you. Everybody's heart, a lot of people's, theirs would stay super high for a long period of time, which shows that their heart does not recover very fast. And so these two here help with that recovery time for your heart, not only your muscles as well too. So definitely look at the X49 for cardiovascular health. The other thing I want you to look at is Eon. And I want to talk to you about Eon. And you would probably think, why is this for your heart? That's a patch that reduces inflammation. Well, inflammation, we know, is the root cause of disease in the physical body. We can see the inflammatory processes, especially when they're not, inflammation's good. We're supposed to have inflammation in our body, but when you have inflammation that doesn't go back to its normalized state, when it's chronic, or it's your body's not able to regulate that, that's when we start to see the disease processes start to creep in, right? And so this reduces a lot of the inflammatory markers, the homocysteines, the cytokines, the C-reactive proteins, the lipids, different things like that. But one of them that I want to talk to you about is called fibrinogen. And fibrinogen has a direct correlation to heart disease. So I want you to research that. Type in the word fibrinogen, Fibrin, fibrinogen. I'm used to typing it. My daughter had low fibrinogen pretty much her whole entire life. Most people have high fibrinogen. And so how do you have high fibrinogen? Well, fibrinogen is a blood clotting factor. When you have a bruise or a cut, your body's defenses to take care of that are fibrinogen and platelets. Fibrinogen and platelets come together, and they come to the wound, or they come to the bruise to help clot the blood so you don't bleed out. And like I said, my daughter had low fibrinogen most all of her life. And so her bruising time, her bruises would be huge. And if she was bleeding, it wouldn't stop forever sometimes, which is why she ended up passing away from a brain bleed. We had it under control for a good period of time while we were using the X39 and Eon with her. And then it just wasn't anymore. It was her time to go. And so this was huge, though, in that last year. She had no bruises. She had no episodes, nothing crazy. Actually, her hormones balanced. She had normal periods and wasn't bleeding uncontrollably. It was fantastic. So when you look at fibrinogen will directly tell you or not whether you're going to have or do have heart disease. It's the clumpiness of it. It's thick. If you look at David's video he did with Michael Jaco, it's on my YouTube channel, where he's talking about the vaccine and looking at the blood under light field and dark field microscopy. He can show, and he has the screen, the slides up there, the fibrinogen, the blood clumped together, thick. Now, if your blood's thick, then it's not running through your veins the way it's supposed to. It's getting stuck. It's getting, building up the plaque. And you look at the cholesterol, right? People look at cholesterol. Well, we can write prescription medications to make that cholesterol look normal, but we don't write prescription medications to make your fibrinogen normal. It just doesn't work that way. And so you want to do something to reduce your fibrinogen, to bring your fibrinogen in balance. And I'll be honest with you, because you may not know, and most doctors don't test for fibrinogen. You can ask, because they can do it. It takes 2 seconds to test for fibrinogen. Actually, it takes a little longer than a CBC, maybe about 15 minutes longer. But I asked David when I first found out about these patches, and I was listening to his videos, and I heard him talking about fibrinogen. I was worried, because Taylor's fibrinogen was always so low. And I told him, I said, if this bottoms out, she's going to die. And he said, it will never bottom out your fibrinogen. It will only bring it into balance. If it's low, it will bring it up. If it's high, it will bring it down. Everything that I do puts the body into balance. And I'm like, okay, I'm trusting you. And it did. Her bruises stopped. Her periods normalized. She had nothing heavy or out of control anymore. So it was absolutely amazing for that last year that we were using the patches with her. So know that it's going to help your heart, because it's helping the blood clotting factors in your body to be normal, amongst other things. And another reason why this patch helps your heart is because it helps your body get into what's called a parasympathetic state. Most people are in that fight or flight, go, nonstop, stress to the max, anxiety, just can't shut your mind off. okay? And that's not a healing state to be in. And so this patch, we kind of nicknamed it the happy patch. It helps bring your body into that parasympathetic state, which is that calm, rest, relax, digest, happy state. And so that's really important when you're looking at repair and regeneration in the body. That's why we use these two together for every single thing under the sun. Because when you can reduce inflammation and put the body in a parasympathetic state while you're increasing and mobilizing your own stem cells, you set the body up for a more rapid, dramatic repair and regeneration process. We call this the dynamic duo. One of the first videos I listened to with David, he said, I want you to picture this. If you had something wrong with your shoulder and you wanted to go get a stem cell injection, and they injected 2 million stem cells into your body, what's going to happen is those stem cells are drawn to the inflammation. This is where the issue is. You have lack of range of motion, you have pain, whatever, there's tons of inflammation. The stem cells are going to go there. They want to repair. It's like a moth to a flame, though. Your inflammation is going to consume the majority of the stem cells. He said you may get an injection with 2 million, you may end up with 200,000. That's how powerful the inflammation is to consume the stem cells. Why do we use these two together? Because this is going to help you address the inflammation, the inflammatory process in the body, signaling a peptide in your liver to upregulate its SOD, downregulate the inflammatory markers that I mentioned earlier, okay? As you're mobilizing, increasing your own stem cells. So it's only going to benefit you for anything under the sun. So you guys are asking me questions already. I'm going to tell you X39 and Eon is absolutely where you start, no matter what, 100%. If you want to add a couple patches, a patch from there, you definitely can. But these two are where you always start, okay? So when I look at the other patch, or before I go to the other patch, I want to show you the couple studies on the Eon, okay? So when I look at, I don't know if you guys can see that or not. Hang on one second. Stop share. Let me share my screen. Desktop. I think I picked the wrong one. Safari. There it is. There we go. Okay, perfect. So when I look at Eon, okay, here. This is where we can see the heart rate variability, and this is showing just Eon in, position. And this, I'll go to the beginning right here, double-blind placebo controlled heart rate variability to evaluate the effects on the Eon patch on the autonomic nervous system. So this is what I was talking to you about, that parasympathetic state, that relax, rest, digest state. So we can see in here, if you guys just scroll down, you can see there's lots of charts, lots of numbers, but you can see here from the discussion, there was nearly significant difference between them. Okay, so you can see differences. And then again, you can just keep scrolling down. Deep relaxation. You can just kind of scan through some of the words. After wearing the patch, majority of participants could achieve stress relief when it was as early as 20 minutes, decreased normalized sympathetic dominance, which is, when you don't want to be in that sympathetic state, right? And so there was an increase in the parasympathetic state, which is what I'm talking about right here. So statistically significant decrease, and which again is what we're looking for, a large decrease in these things, that the sympathetic state, which is what you don't, right? You want that to come down. You want your body to be in that rest, relaxed state. So based on the observations that we could see that within just 20 minutes, it enhanced that calm, relaxed state. And it can be quantified, of course. And so that's what you're looking for when you're looking at some of these studies. You're looking for the conclusion and what they're doing. And you can scroll through. I think I have maybe one other. This is the one I was talking about with the heart rate variability and being able to see the difference in the with your heart rate and how that is functioning. And then let me see if this is a different one. I already showed you that one. This is a different one. So again, you can just scroll through here. But if you look at these studies, where's my screen? This one. Okay, so look, if we go down through here, and again, I'm not going to spend too much time on this, but look, heart rate variability signals, right, during rest and relax. This is showing again the energy in patches, how they affect that. So you can see what's happening just by a simple glance at the little, summary here on how these patches are making a difference. So you can, if anything that says heart rate variability, anything that says, vascular system, any of that, that's what you would want to click on for this. Okay. And so again, I'm not going to go down through all of these, obviously, but I just want you to kind of take a look down through them for yourself so you can see the benefits of these patches. Heart rate rhythm analysis study of all of the YH, which is the X39 Eon and the glutathione. So just know that you've got plenty of science here with lots of different doctors and researchers all over the globe. Okay, the last patch I want to talk to you guys about, and then I'll open it up for questions, is called carnosine. And carnosine was one you obviously saw clinical studies on there. Carnosine is a patch that a lot of people are like, well, that seems like it's similar to the X49, but I want you to know that this is a different peptide. Okay, so this is AHK-CU, carnosine is a dipeptide, so it's totally different pathway that's being signaled. And we've always had carnosine, right? We've had it for years and years and years. I don't know how many years, 10, 12, 15 years. I don't even know off the top of my head, but we've had it for a long time. And so they do work differently, signaling different pathways, but they do both directly impact the heart in a beneficial way. We know carnosine impacts the brain and the muscles as well, just like the X49, but in a different way. And I love that David was talking about carnosine when he did his Zoom on the heart health a couple of weeks ago, where he was sharing. If you would just Google carnosine, like research, there's tons of clinical studies out there, just carnosine as a nutrient. You can see that carnosine is very beneficial to the arteries, actually able to help clear clogged arteries. Carnosine. I know my friend Laura, when she was going through her breast cancer treatment, she had breast cancer stage 3 5 years ago. And she chose to cure herself naturally with IV therapies, vitamin therapies, detoxification, supplementation, changing her diet completely. And 6 months later, she was cancer-free, and that's been 5 years. Part of her protocol was not only glutathione, of course, IV pushes massive amounts, suppositories every single night of glutathione, but another part of it was carnosine. Carnosine is a huge antioxidant, and we know that carnosine loves to repair the heart. And so it loves to repair anything in the body, free radicals, the organs. We look at the organs. You can see clinical studies on the benefits of carnosine on your pancreas, on your kidneys, on your liver, just like the Eon and the glutathione as well. They directly impact your organs. And so when you can reduce inflammation, increase your antioxidant level in your body, the body then goes to work to repair itself. And so carnosine was something that she was compounding. She had compounded carnosine that she had to take every single day to be able to go through this treatment to help eliminate the toxic cells in her body. So this one is huge for overall health, of course, but definitely for heart health too. So those are my 4 patches for heart health. Again, you can just start with X39. It may be like Dr. Harmon that it takes 6-7 months before it repairs your heart. I don't know. It may be like Dr. Sanders. It took a year before he could see significant changes. I mean, that's significant, right? Or even Aaron Winders, who could see a difference in a matter of a couple months. I don't know how fast you're going to see results with X39, but I know you will if you keep using it. If you want to add in some other patches, you can. Other patches are only going to work together synergistically to impact that system, specifically the cardiovascular system, in a beneficial way to help your body to get back into balance at a faster rate. That's why we use supportive patches, to support the systems that we're targeting in order to help the body to get back into balance at a faster rate. Again, no medications, no contraindications. You can be on your blood pressure medication, your cholesterol medication, all that kind of stuff. You're not going to have any interactions with these patches at all because nothing is coming into the body. They're non-transdermal. So you can safely use all 4 patches at the same time. If you want to use X39 and 49 during the day and carnosine and Eon at night, you can. For those of you that have the monkey mind, use this Eon below your belly button at night. That'll help you get in that nice rest, relax, digest state. If you want to use all 4 during the day, you can use all 4 during the day. You just can't use these 2 at night. Okay, so whatever works best for you. And placement, of course, is going to be in the instruction booklets that come with the patches. So definitely check with those. All right. So let's look at some of our questions, right? So we have hernias. So remember, I can't talk specific to diseases or any kind of conditions or syndromes or anything like that. But when we look at wanting to put the body back into balance, again, I would definitely start with X39 and Eon. We want to reduce the inflammation that's in the body and help the body to repair itself. When you look at brain, things going on with, stress, post-traumatic stress, things like that. Of course, you would look at, honestly, all of these patches work for the brain. They work for the heart and they work for the brain. Same for patches. But we do have a patch called Nirvana. And Nirvana, it's actually a patch and a supplement, and it works amazing. It works with neurotransmitters and neurohormones in your brain to help you really calm down, relax. It helps with the depression, the anxiety, severe anxiety, and trauma. So look at the Nirvana system. What kind of sauna? I want one. Mine is a sun lighten. I love it. I love it, love it, love it. Obviously, it's hot and I sit in it 30 to 40 minutes, maybe 4 times, 5 times a week. But I love the patches because they're super simple, easy, and I can wear them anywhere, anytime. But I love the sauna too, because it's just good to sit there and sweat, right? So gut issues, you would definitely use X39 Eon. You would use glutathione as well. Glutathione being the master antioxidant detoxer immune booster, and also SP6. I work with Dr. Mel. She is a gut specialist in the gut microbiome, and that is her protocol for her clients that she has: X39 Eon, glutathione, and SP6. When you look at your organs, female organs in your body, the YH series all impacts the organs in a positive, beneficial way, as well as, of course, the X39. I can't say that it'll help with endometriosis. I have no idea. Remember, I have no clinical studies with any diseases or syndromes. We just don't. David didn't do any of those because we would claim to treat or cure something. So when you look at the organs in the body, then those are patches that would help the organs. Okay, so you put IceWave on a friend who had 2 knee replacements, suffers from osteoarthritis. It didn't work. However, I put Eon on the inside of the knee and glutathione on the outside, and it worked. Yeah. And so here's the thing: when you look at pain, why did the other patches work and not the IceWave? So that Eon and glutathione combo does work amazing a lot of times for the knee. Eon reduces inflammation. Inflammation causes pain. And we know glutathione coats the joints. So when you put this patch on, you have to understand that it starts working immediately if you can feel it or not. No matter what, when you put a patch on, it is working instantly because it signals peptides at the speed of light. And so glutathione is what we call the master antioxidant detoxer immune booster, but it also coats the joints. And so not that it immediately coated the joints like probably you're visualizing, we call it liquid gold though, but it does work a lot of times using them in combination around the knee, one on the outside and one on the inside. If the IceWave didn't work, I would look at the placement because pain is stuck energy. And so the IceWave only works by opening up the energy channels. So maybe it was just having the X39 and Eon on that helped it, just a reduction of inflammation. We're all different, but the IceWave will definitely work. You just have to find the spot. Maybe you do the clockwise method, or maybe you put the white one on the right knee and the tan one on the left knee, but play around with it because it's definitely a fantastic patch. It'll get rid of pain on the spot. Is there any chance that these patches could reignite something negative for cancer survivors? That's a great question. And we don't have any clinical studies that, in all of our clinical studies, that show any negative effects whatsoever in someone, whether they had any kind of health condition, whether it be cancer or anything else, because we are studying these people for months and years on end. And you can see that from the studies. One of the most recent X39-49 studies took place over the course of a year from the participants. We have not seen any of that, so I definitely cannot say yes, we have, or no, we haven't. We don't have any in our clinical studies. So I would have them check with their doctor if they have any concerns or questions, of course. If someone with Parkinson's has really bad reaction, detoxing, shaking, dizzy to X39, would you recommend wearing for less time or adding different ones? So when you blood pressure, diabetes, so when you look at someone with a lot going on in their body, probably on medications, a lot of different compound effects, you don't have Parkinson's, that just happens overnight. It happens over years and years and years of buildup. And let's be honest, that's toxicity. Okay. And so we have to look at detoxing the body on a daily basis, on a regular basis, on a quarterly basis, at least once or twice a year. It's like having a car and never changing the oil in your car. Like, why would you do that? It wouldn't go. My car light went off last week and I'm like, oh my God, let me get the car in right away. I called instantly to make an appointment. I'm, that thing locking up on the interstate. Well, if you've got Parkinson's, your body's locked up. It's done. Like, you went way past the oil change point. You should have done that 20 years ago, 10 years ago. And so if someone is experiencing some type of detox, one thing I would ask is I would say, are you consuming enough water? Most people don't drink half their body weight in ounces in water every day. They just don't. People don't like water. They don't choose water. They choose coffee. They choose tea. They choose sodas or wine or beer, whatever. So I would ask about the water amount first before I would say that X39 should be reduced in time. You can reduce it, do 6 hours a day if you want, but I would make sure the water consumption's happening. That's a definite. Breathing, asthma, high blood pressure, fluids in the heart and lungs. I would definitely use the X39. I would use the Eon and the Energy Enhancer. Energy Enhancer is the first patch that David invented 20 years ago when he was working for the Navy SEALs. He was asked to help the SEALs with their issue of being on amphetamines and uppers and caffeine, and their quality of life was reduced. And so he was given the information by God to create this patch, a non-transdermal patch that triggers beta oxidation, which means turns body fat into fuel. And so he invented the Energy Enhancer, and it has a beautiful side effects. It has a white patch and a tan patch. And so it works, again, with the polarity of your body in a different way than Ice Wave. Again, this triggers turning body fat into fuel for energy, stamina, endurance, but it also turns over the lymphatic system. So you would use white on the right, tan on the left, on the lung points to help get that excess fluid out of the lungs. It's fantastic if someone's had, the jab, or they've had the, COVID or whatever, to help get rid of the excess and help get that lymphatic system moving. This definitely helps your lymphatic system. Heart age, and you're gonna have to go to start. I'm sorry, we don't have enough time, but go to startx39now.com and you can read the clinical study on how it was measured. It was measured with the BioWell, but all the information's there. I just pulled I showed you a little clip of it, but all the studies there. Every clinical study that David or anybody's ever done in the last 20 years is there, and it's there in detail. You don't get to have a study published unless it's complete, right, and proven. So when you look at mastectomy pain and recovery, I would definitely use X39 and Eon, of course, and Ice Wave it for pain. If you have low blood pressure, will X39 raise it? Mine's load's gone up since using the patch. So here's the thing. Again, these patches are designed to put the body into balance. So balance is what this is all about. I'm not going to say it's going to raise your blood pressure, lower your blood pressure. It's going to put your blood pressure where it's supposed to be, as it's going to put all the systems and organs in your body where they are supposed to be. Homeostasis is what we call that in the body. So the body should be in homeostasis. Most times it's not. It's out of balance for one reason or another: diet, lifestyle, surgery, injury, illness, stress. Our stress level puts the body out of balance like this. You can think of something that ticks you off and you start getting pain in your body, right? Just your thought of something that frustrates you puts pain in your body. Your thought of something that makes you happy and joyful and grateful and loving, it's like the pain's gone. Do you guys notice that? Like, literally, you can be in those different mental states and affect your physical body. So know that this is all about balance, homeostasis, okay? And yes, I'll have the recording on my YouTube. Lori, I can't wait to interview you on Thursday night too, so you can tell us all about. I think she said she was on medication for her heart for 28 years and is no longer on the medication. So tune in at 9 p.m. Eastern on Thursday night. I'll be interviewing Lori. Long-standing AFib issues, absolutely yes. Again, anything in the heart, anything in the entire body, it's going to help bring it into balance. Don't know the time frame, can't give you a time frame on anything. I just know that if you continue to use this technology, it's going to continue to improve your life. Studies, we have no studies with any type of conditions, issues, symptoms, diagnosis, diseases. We have no studies with that. We look at systems and we look at organs. Otherwise, we would claim to treat or cure. That's fantastic. Yep, check out startx39now.com. You guys can see all the studies there. Yep, we can definitely. Okay, so you can go to, Emily, if you go to the Be Activating Telegram channel, you guys can also go there and you can type in, search whatever it is that you're looking for, to whether POTS or whatever it may be. You can see people's personal testimonials sharing, but again, we have no clinical studies on any diseases. Great to hear. I love all the great things you guys are sharing. So can it normalize it? It absolutely can. It can. I'm not saying it's going to, but it can. If it's out of balance, it can bring it into balance. Definitely. Change in heart. Yep, it can help. Thank you, Laura. Thank you, guys. Thanks. Veterinary studies. So we don't have any veterinary studies with X39, but we do have veterinary studies with AccuLife. So if you search for AccuLife, AccuLife is our patch that is registered for animal veterinary use. Of course, you can use any of the patches on animals, just like you can people. But we have no clinical studies on any of the others. All right. You're welcome, Rhonda. Thank you. So yes, it's being recorded. Absolutely. And let's see, we've got some repeats. I just want to make sure I get to all these questions real quick. So if your doctor tells you you have some type of issue going on, then just ask him if you can use a non-transdermal patch, and I would take him the information for sure. So you wear your patches together during the day for 12 hours. Absolutely. You definitely can do that. Dr. Clinchy, thank you for sharing. He says he has a history of 2 heart attacks. I interviewed him as well last year. 25 and 15 years ago, 6 months ago, he noticed he was throwing PVCs fairly frequently. Now, a year into X39 Eon, I'm not identifying PVCs at all. So sort of reinforces the parasympathetic impact of which you have mentioned. Fantastic. Thank you for sharing that. Yes, I remember that from interviewing you, your heart attacks, because we actually didn't get to go over that part. There were so many amazing things that have happened for you. Yes, if you want to go to startx39now.com, that is where you will find all of the clinical studies. And then when you look at sinuses, X39 Eon, of course, energy enhancer would be fantastic. Are the patches half-day usage only 12 hours? You would wear them 12 hours and then 12 hours off, and then do it again the next day. Your body needs a break. We need a break from the communication, right? We're emitting that light. Someone had prostate cancer. Is any cause for concern wearing X39? Please check with your physician. Of course, we cannot make any recommendations with anything to do with cancer, but you can definitely search in the Be Activating community, cancer, prostate cancer. You can hear lots of men sharing their personal experience with their prostates, specifically X39 and Eon. Nirvana, again, clinical studies, startx39now.com. You'll see amazing clinical studies on Nirvana. So here's the deal with carnosine. A lot of people ask about this. Can you use carnosine? It says 1 to 3 days per week. So carnosine was initially promoted as a patch to help build lean muscle mass. And so the anticipation there is that you are exercising on a daily basis, or otherwise you really don't need it. Of course, further clinical studies showed its benefits on not only your lean muscle mass, but also on your organs in your body, specifically your pancreas, when you look at the glycation process and what this does to normalize blood sugar, which is something you would do on a daily basis, right? The benefits on your brain, meaning specifically improving cognition, balancing left brain, right brain hemisphere, helping to improve communication, executive faculties, your mental faculties, the processing time in your brain. Carnosine speeds that up like that. Like, this is a patch that I have my husband wear every single day. I would not have anybody go a day without carnosine. So initially in instructions, and we need to get the instructions rewritten, in my opinion. I'll have to have a conversation with David about that. But I think carnosine is something that should be used daily. It cannot hurt you. It's a nutrient. It's an antioxidant. This is not putting carnosine in your body. It's asking your body to bring its own carnosine level into balance. So it can never throw anything out of balance, remember? So it can only benefit your heart. It can only benefit your brain, your muscles, and your organs in your body. So you can use carnosine every single day. I've used carnosine every single day for almost 2 years. And I would say my executive faculties in my brain are wiring and firing pretty fast. Plus, if you Google carnosine as a nutrient, you can see that carnosine actually detoxes aluminum from your brain. How many of you guys cook with aluminum pots or pans? How many of you use aluminum foil? How about deodorant? They all have aluminum in them unless it specifically says aluminum free. Any of you guys use any of that stuff? Then you have aluminum in your body, not to mention the toxins from pesticides and, the air and things like that. So I would definitely do everything I can to get rid of aluminum, which, if you want to be honest, let's look at the heavy metal toxicity and buildup. When you look at the neurological disorders, when you look at autoimmune, you look at things like that, you're looking at a toxicity buildup. And so we've got, again, detoxing the body, helping remove these toxins from the body. So it's very, very important. And this replay will be on my YouTube channel, DrStaci. Dr. Staci is my YouTube channel. So as far as research, we have no research that says there's a reduction of tumors. We cannot show that. Oh my God, we would treat or cure. We would make those claims, right? But again, go to the Telegram channel and search tumors. I remember interviewing a lady last year that had lesions on her lung that were centimeters, then they shrunk to millimeters. Again, that's her personal testimonial. Marcy Preble, you guys know Marcy. Marcy had breast cancer that metastasized to the skin. That's gone. So we definitely have seen or heard of people, but we don't have any studies, right? StartX39.com does have, StartX39now.com does have all of our studies though, okay? As far as the trigeminal, I definitely remember interviewing a lady about that last year, X39 Eon, and then of course Ice Wave for the pain. And yes, lots of studies on veterinary. You guys are asking lots of questions about animals. Yes, definitely. Go to YouTube. LifeWave Health is our YouTube channel. LifeWave Health is our YouTube channel. You will be able to just type in LifeWave AccuLife, type in LifeWave Pets, LifeWave Horses, LifeWave Cats, LifeWave Dogs. Be resourceful. Go search YouTube. You will find lots and lots of videos out there of people sharing. My YouTube channel has one video. I interviewed a lady about horses last year. But when I look at going back to blood sugar is X39 Eon and carnosine. Okay, definitely add the carnosine in. Nerves, neuropathy, pain, swelling, X39 Eon, and the Ice Wave, of course. I interviewed Dr. Peavy, who is a chiropractor of 40 plus years that specializes in neuropathy. He has a fantastic podcast on our The Activating channel. Check his out. He makes recommendations exactly where to put the patches. So definitely look him up, Dr. Peavy, as a chiropractor. And he shows you exactly what he has done to take his patients that were like 75, 85%, like not going to walk in a wheelchair, not going to get any benefit at all. And after using the patches, X39 Eon, Ice Wave, glutathione, carnosine, and where he's, recommending them, because there was 2 sets of Ice Wave, I remember correctly, bottom of the feet and low back. He was getting people up and walking and moving and their pain reduction dramatically. He's like, I had nothing for them. Now I do. So that's huge. I need to get him back on for another interview. He was so good. X39 Eon for 2 weeks. Oh, that's feet. Oh, that's feet. Your feet are better. Awesome. I love that. Thank you for sharing. Anything on veterinary cases? AccuLife. When we look at Graves, again, I have to just talk about the thyroid, the endocrine system. X39 Eon and SP6. Okay. Energy enhancer patches, turn over your lymphatic system, turn body fat into fuel, and move energy in the body. Stuck energy means you're going to have issues. It increases the ATP in the cells, the mitochondria. I was listening to an incredible podcast, Dr. Zach Bush. I love that man. His brain is genius, like David, just crazy amazing. And he was talking all about the mitochondria, which are actually living bacteria inside of our cells and our energy or ATP in our cells. And as we age or issues or diseases or things pop up, then our cells communicate through this energy system, this mitochondria. And if it's not functioning correctly, then you have disease. And so he was talking about keeping that energy functioning, that communication functioning right in your body. An energy enhancer does that, right? So definitely. Oh, I love it. Okay, so I think we've got one more. We're out of time. I'm going to make sure brain, X39 Eon, X49 carnosine for sure. Definitely, if your doctor tells you to stay away from the patches, how do you respond? You go hire another doctor. They have to be open. I'm just being honest. Like, you've got to find somebody that's open to do things besides medicines and surgeries. So just go fire him and hire somebody else. There's plenty of people out there that care and that are looking to help you in any way. And if you say I have a non-transdermal patch, then they should be open to that. They should be. There's so much out there now. We can't just think it has to take place inside of a bottle, right? I don't remember how to spell PV. I want to say it's PEEVY, but I can't remember. It's got a Y in it, so I don't know if it's PEEVY or PEVY, or I don't know. I'll have to ask Laura. But definitely he's on there, I promise. You guys are very, 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 very welcome. Very, very welcome. All right, so from my heart to yours, happy Valentine's Day. Happy Heart Day. I love you guys. I'm grateful for you guys. And I want the best of you, not only for your heart, but for all of your entire body. So please get back with the person that invited you. If you're a guest tonight, they can help you get set up with whatever you need, whatever patches best serve your needs, and different types of wholesale packs. We've got 4 different packs to choose from. So they can help you, and know that we're all one big community. I have referenced our YouTube channel, our Be Activating Telegram channel, our site that we have our clinical studies. We have lots of resources to be able to help you. Lots of us work together. We're a huge community of people that care, working with our heart, right? To be able to help people improve their quality of life. So thank you all. Enjoy the rest of your Valentine's Day. I'll see you on Thursday at 9 p.m.